I'm Jennifer Smith.
And I'm Melva Jones.
And we are Women's Health in Black and White. Today I have a serious topic to address. We're going to talk about spontaneous miscarriage.
Okay.
It's also called spontaneous abortion. Please don't be offended by the word abortion. It just means the end of the pregnancy. We try to have a good time, I think.
Right.
But there's absolutely nothing fun about this topic, so I apologize up front. Here's the deal. It is common. No one talks about it, which does women a disservice.
It really does.
Because
it's like a big secret. Nobody
talks
about it. It's kind of like an embarrassment, or it's like something that people are like, oh, you know, so-and-so had a miscarriage, but don't say anything about it, or don't ask her about it. And that's the biggest problem. Nobody is talking about it. So then when you do have women who experience it, they're like, I'm abnormal because everybody else has healthy babies, like, because nobody else is talking about the abortions they had before they had those healthy babies or in between, and so it kind of makes that person feel isolated, but you're really not isolated. It's so very common.
Matter of fact, it's 1 in 8. 1 in 8 pregnancies end in miscarriage. And when you do have a miscarriage, people will come out of the woodwork.
Yeah.
You'll find out that your mom had 2 and your aunts had them and your best friend had, so I think that we would be better sisters to each other if we would just make this not hidden anymore. If we would say, this is what happens and it sucks.
Right.
And we're going to get you through it. Let me say, before I say anything else, that pretty much nothing that you did caused your miscarriage. You could be on bed rest from the moment that you conceive, and you may or may not miscarry. You could do jumping jacks from the moment that you conceive, and you may or may not miscarry.
Right.
It doesn't happen when you have sex. It doesn't happen because you went to work. It doesn't happen because you went jogging. You didn't do it.
Right.
Some have no signs or symptoms. So you can have a spontaneous miscarriage that starts with cramping and bleeding. It's easy to identify those. You can also have something called a missed AB. You just come in for what you think is a regular visit and we can't find your baby's heartbeat.
Right. Those are the most devastating.
Those are horrible. And it's not that, it's just that we caught it before your body caught onto it.
Yeah.
It would have ended in a spontaneous miscarriage. We just caught it before it could happen. Most of the time, though, you're going to have cramping and bleeding, and you may even pass clots or pieces of tissue. There's several different kinds of miscarriage.
Yes.
So there's some miscarriages that are caused by abnormal genes. The recipe that made your kid just wasn't right. One of those kinds of miscarriage is called a blighted ovum. A blighted ovum means that it was a normal conception, but the embryo stopped growing and was absorbed, leaving you with an empty gestational sac. And the body has a hard time sometimes recognizing that the pregnancy is gone. And so those are ones that just sort of linger for a while. This is a very, very early loss. And sometimes this is what's called a chemical pregnancy. It happens so fast and it's over, and you never have any cramping or bleeding, it's just gone. But sometimes this gestational sac persists for weeks.
Right.
And you have to have what's called a D&C, a dilatation and curettage, to get the sac out of your uterus so that you can start over. It's usually a chromosomal problem that causes this to happen. Some miscarriages happen because of something called intrauterine fetal death. There was a heartbeat, and then there wasn't. We don't know why. I wish we did. I wish I could say it happened because of this.
Yeah.
So that we could fix it. It would never happen again. I don't know why. Some miscarriages are something called a molar pregnancy. This one is the one that's scariest to me.
Right.
Because molar pregnancies can be associated with cancer down the road. What happens with a molar pregnancy, you can have a molar or you can have a partial molar. A molar pregnancy means that the genetic information in that embryonic sac came from dad, and dad exclusively. So there's nothing from mom in this sac. That means there's not enough genetic information to go on. No fetus develops. but there is an abnormal growth of the placenta. The placenta can grow exponentially, and it can grow into the uterine lining, and these cells can cause cancer down the road. A partial molar means that there is cells, genetic information from dad, and some from mom, but not enough to create a healthy baby. This pregnancy was never going to result in a healthy child.
Right.
And it is very important to have follow-up when this happens, because like I said, this can be associated with intrauterine cancer, and it's a very, very big problem. There are a few maternal conditions that predispose you to a miscarriage. Diabetes is one of them. So if you know that you have diabetes before you're trying to conceive, this is the best time to get your blood sugar under control before you start trying to have a baby. Some vaginal infections and uterine infections can cause miscarriage. Hormonal problems can cause miscarriages. So when Candace was here several weeks ago now, she talked to us about infertility. And she said that if you do not ovulate the right way and in a timely way, your progesterone doesn't kick in from the corpus luteum. It doesn't make enough progesterone to keep the pregnancy going. And that means that the pregnancy isn't supported and you wind up having a miscarriage. That's one possible cause. There can be a problem with the way the uterus or the cervix is formed. Now, these are rare, but nobody suspects them.
Yeah.
So you get pregnant, and then because of the way the uterus is made, there's nowhere for the baby to implant, or it implants in an incorrect spot, and it cannot live there. Once you lose a baby, that can be diagnosed. We look on ultrasound, we can see, and then hopefully there's surgical procedures to help fix that. Uncontrolled thyroid disease is another problem. We can talk about thyroid disease in its own separate thing later.
Yeah.
The thyroid is the master hormone in the body. It has a hand in the function of all your other hormones,
it really
and
does.
I mean just about everything is controlled by your thyroid. So if your thyroid is uncontrolled, if it's too high or too low, then it definitely is going to make conception and the sustaining of a pregnancy very, very difficult. There are symptoms of thyroid disease, and we'll talk about them all later, but if you're having trouble with really dry skin or brittle hair, or you're always hot, or you're always cold, or you're losing weight, you don't know why, you're gaining weight, you don't know why, those are all signs that there's something going on with your thyroid and it needs to be checked out. What does not cause miscarriage? Sex does not cause miscarriage.
No.
Exercise does not cause miscarriage. Going to work, as long as you don't work around dangerous chemicals, that will not cause miscarriage. Now, when I have a couple in my office who've had a miscarriage before, or when she has threatened miscarriage, like she's got bleeding, I usually tell them pelvic rest. Nothing in the vagina. No tampons, no intercourse, nor douching. That is not because I think that intercourse is going to cause miscarriage. It's because I don't want them to miscarry and then blame each other.
Yeah.
So I usually tell them to avoid anything in the vagina until at least 12 weeks, or until we have another visit with a normal heartbeat. Age definitely plays a role in this.
It does.
When you are less than 35 years old, your risk of a miscarriage is 1 in 8. When you are 40 years old, that risk increases 40%. When you are 45 years old, that risk increases 80%. Having a history of an abortion means that we're more likely to wonder if you're going to have an abortion again. There are a few things that you have some control over. I would never blame a woman for a miscarriage. But there are things that you can do. You can get your weight under control. You can get your diabetes and your blood pressure under control. And you can avoid alcohol, tobacco, and street drugs.
Yes.
Those are all going to help you. The other cause of miscarriage, which we don't talk about very much anymore because we don't do them very much anymore, but invasive prenatal testing can cause miscarriage. And what I mean by that is amniocentesis or chorus villi sampling. We have these tests now that can be done as early as 12 weeks that are non-invasive prenatal testing for Down syndrome, trisomy 13, and trisomy 18. And because we have these things, fewer couples are opting to do an invasive test.
Right.
But when they put the needle in your belly to do the amniocentesis or the CVS, there is a chance that they could damage the pregnancy.
Mm-hmm.
There's about a 2% risk of miscarriage involved in those tests.
Right.
How do you prevent a miscarriage? Honestly, when you think about the things that have to go right to get us all a healthy baby,
I know.
it's amazing that we have
That we
healthy
do
children.
have kids.
If you've got healthy children, go home and kiss them because it's amazing.
Mm-hmm.
But there are some things that you can do. You can get early prenatal care. You can get preconception care.
Yeah.
So that we can help you get those issues under control. You can avoid risk factors. Avoid alcohol, tobacco, street drugs. Watch your diet. You can also take a daily multivitamin. And I recommend that my patients start a daily prenatal vitamin 3 months before they want to be pregnant.
Mm-hmm.
Because the most important time to be taking it is the 3 months before and the 3 months after conception. Now, this one's a little controversial. There is a pendulum in healthcare.
Mm-hmm.
Sometimes we say this, sometimes we say that, and it seems to go back and forth.
Mm-hmm.
So what I'm talking about is caffeine.
Oh God, yes.
My mother drank pots of coffee pregnant with all 3 of her children.
Mm-hmm.
We are all my brothers, we're fine. We're all fine. She never had a miscarriage.
Right.
But right now, there's some evidence coming out that is associating even a moderate intake of caffeine
Mm-hmm.
with an increased risk of miscarriage.
Yeah.
And generally speaking, if you don't have to do it while you're pregnant, maybe you shouldn't.
Yeah.
So I have always told my patients that a cup of something caffeinated a day wasn't going to hurt them, and I still believe that that is true. But I also think that people don't take into account how many things have caffeine in them.
Right. Yeah. They're just thinking coffee.
They are
or
absolutely
a
thinking
soda,
that
and
they
that's
can't
it.
go to Starbucks.
Yeah. Mm-hmm.
But that monster, that
Yes.
is loaded with caffeine.
Mm-hmm.
Your sweet tea, caffeinated.
Yeah.
So I do want you to be aware of all of those things too.
Mm-hmm.
Losing a baby sucks. And it doesn't matter if that kid is a fetus or 4-year-old.
Mm-hmm.
It's horrible to
Yeah.
lose a child. And it's a scar that I don't think will ever quite heal. I would never want to downplay a miscarriage in your life. It's trauma, and you will have to process and grieve and get through it. But having one miscarriage doesn't mean you won't have a healthy baby.
Right. We
can still get you a healthy pregnancy. So get early and good prenatal care, and let us help you get a kid. If you have questions about this topic, if there's a topic we haven't covered and you really want to see us cover, please get in touch with us on Facebook, Instagram, Twitter. We have a podcast called Afterglow where we talk about things a little more informally. We would love to have you like and share that. And if you have any issues that you want us to address, we sure do want to do that. So
Right.
let us know. Be well.
Bye-bye.